to me. You're under arrest. Get ready to stand up.
Please.
Just 20 minutes, they're getting chemo.
No, she's sick. You can't do this.
Ma'am, step back now. This treatment stops. She's coming with us.
She had 20 minutes left to live like a free woman. They took either 4 drip, was almost finished. Just 20 more minutes and Carmen Rodriguez would complete her 3rd round of chemotherapy treatment. She sat quietly in the hospital chair, her mother holding her hand, both of them watching the clear liquid slowly make its way through the tube that would hopefully save her life. The oncology ward was peaceful that Tuesday afternoon, filled with the quiet sounds of machines beeping and nurses moving between patients with gentle voices and careful steps. Carmen had been fighting lymphoma for 8 months. At 26 years old, she was determined to beat this disease and return to her job as an elementary school teacher. Her students had made her cards that covered the walls of her small apartment, colorful drawings with messages like, "Get well soon, Ms. Rodriguez, and we miss you." She carried those cards with her to every treatment, a reminder of why she needed to keep fighting. What Carmen didn't know was that 3 men in dark suits were walking through the hospital corridors at that very moment, flashing badges, asking questions at the front desk, and quietly coordinating with security. They had been tracking her for weeks, waiting for the right opportunity, and they had decided that this moment, while she was vulnerable and connected to life-saving medication, was their perfect chance. But these agents were about to make a decision that would destroy their careers, humiliate their agency, and cost taxpayers millions of dollars. Because Carmen Rodriguez wasn't just any patient. She was about to become the woman who would change immigration enforcement inside American hospitals forever. Carmen had come to the United States when she was 3 years old, brought by parents fleeing violence in their home country. She grew up in a small Texas town, spoke perfect English, graduated high school with honors, and worked nights at a local diner to put herself through college. She applied multiple times for legal status, but the system moved slowly, her applications delayed or denied on technical grounds. When she was diagnosed with cancer, Carmen qualified for emergency Medicaid, allowing her to receive treatment at the county hospital. She never hid. She paid taxes using an individual taxpayer identification number. She volunteered at church. She helped elderly neighbors with groceries. She was exactly the kind of person most Americans would want living next door. The 3 IC agents who entered the hospital that day saw her differently. Agent Robert Sullivan had spent 12 years in immigration enforcement and prided himself on hitting his monthly arrest quotas. His supervisors were pressuring the team to raise their numbers, and hospitals had become a favorite tactic. Sick people couldn't run. Sick people were easy targets. He had received a tip that an undocumented woman was receiving expensive cancer treatment paid for by taxpayers, and that she would be there every Tuesday and Thursday for the next 6 weeks. What Sullivan never checked was that Carmen had pending applications and medical protections on file, protections that legally shielded her from removal during treatment. He wasn't interested in legal research. He was interested in easy arrests that looked good on reports. The agents took the elevator to the oncology unit. At the nurse's station, Rebecca, a 15-year oncology veteran, immediately sensed something was wrong. She explained that Carmen was in the middle of chemotherapy and that interrupting treatment could be dangerous. Sullivan brushed her off. Rebecca stalled him in a conference room and made 3 calls: legal, her supervisor, and security. All 3 confirmed the same thing. Immigration enforcement had no authority to access patient care areas without proper legal documentation. When Rebecca returned and informed the agents, Sullivan threatened her, falsely claiming she could be arrested for obstruction. Rebecca didn't flinch. She told him calmly to arrest her if he thought he had grounds, but he would not access patients without documentation. Instead of backing down, Sullivan walked straight into the ward. Room by room, he searched. In room 314, Carmen was resting while her mother Sophia watched the drip. Sophia felt the fear instantly. She shook Carmen awake just as the agents appeared in the doorway. Sullivan stepped inside and announced the arrest. Carmen didn't resist. She didn't run. She asked for 20 more minutes. 20 minutes to finish life-saving chemotherapy. Instead, Sullivan reached for her 4-line and ripped it from her arm. Blood spilled onto the bed. Carmen cried out. Sophia begged. Heart monitors screamed. Nurses rushed in. Rebecca ran. Security was called. The peaceful oncology ward collapsed into chaos. Sullivan handcuffed Carmen anyway. She stumbled. He shoved her mother aside. Phones began recording. Patients shouted for police. Children cried. An oncology unit became a crime scene. Despite doctors pleading that her life was at risk, Sullivan marched Carmen out in handcuffs, in a hospital gown, into the cold. No coat, no phone, no belongings, no answers. She deteriorated in detention. Her chemotherapy was delayed. Her immune system collapsed. Her condition became critical. Doctors warned of fatal consequences. Public outrage exploded. Investigations followed. Sullivan's past of targeting vulnerable patients surfaced. Congress took notice. Medical organizations condemned the arrest. Carmen collapsed. She was finally released on medical parole. Her cancer had worsened. Her treatment had to restart, stronger, riskier, and far more dangerous. Her legal team uncovered internal IC emails proving supervisors approved arresting her during chemotherapy because she couldn't flee. That became the smoking gun. The trial shocked the nation. Carmen Rodriguez was awarded $18 million. Sullivan was fired and charged. Supervisors were disciplined. ICE rewrote hospital enforcement policies nationwide. But the real victory was bigger. Hospitals became protected spaces. Patients gained new rights. And Carmen, after fighting both cancer and injustice, eventually returned to her classroom. Her students welcomed her back with new drawings that read, "Welcome home, Miss Rodriguez." Her case became a civil rights landmark, proof that even the most vulnerable can change an entire system, and that sometimes one woman's courage can rewrite the rules for everyone that are in handcuffs instead.